So chapter 24, Gynecologic Emergencies. Introduction. Women are uniquely designed to conceive and give birth. Because of that unique design, women are more susceptible to problems with the reproductive system than men. And they may have issues that men do not experience as well. Now let's review the anatomy and physiology of the reproductive system. External female genitalia includes the vaginal opening, the labia majora, the labia minora, the clitoris, and the perineum. The perineum is the area between the anus and the vaginal opening. It's a very important landmark to note when you're doing or facilitating a field delivery, because it can tear if the delivery is explosive. Now, all of these structures, especially the outer ones, are highly sensitive, so they have a lot of nerve endings and they are very vascular, so they can bleed a lot if injured. And that's a diagram indicating the structures. This area would be the perineum, and this is the area that I'm talking about that can tear if the delivery is explosive. Now, ovaries are primarily internal female reproductive organ. They lie on each side of the lower abdomen, and they produce ovum or egg. And a female is born with all the eggs that she will need for the rest of her life. And each month they release an egg alternately. So if it's the left ovary this month, it's going to be the right ovary next month. You have the fallopian tubes, which connect each ovary with the uterus. The uterus is a muscular organ where a fetus grows. It is the narrowest part of the narrowest part of the uterus is the cervix, and the cervix opens into the vagina. And the vagina is the outermost cavity of a woman's reproductive system, and it forms the lower part of the birth canal. Here's a diagram depicting all of that. You can see where the ovaries are, the cervix, the vagina, and the uterus. Ovulation and menstruation begin in puberty. The onset of menstruation is called menarche. It occurs between age 11 and 16 years. Women continue ovulation and menstruation until menopause. This occurs around age 50. Each ovary produces an ovum in alternating months, and this is ovulation. The process of fertilization begins in the vagina. Sperm are deposited from the male penis, and it passes through the cervix to the uterus and up to the fallopian tubes. The embryo, once fertilized, will travel into the uterus and attach to the uterine wall, and it continues to grow. If fertilization does not occur within about 14 days of ovulation, the lining of the uterus begins to separate and menstruation occurs for about a week. The process of ovulation and menstruation is controlled by female hormones. Pathophysiology. So that was a review of the anatomy and physiology. If you want a more in-depth review, go back to the human body lectures. So let's look at the problems now. Pathophysiology. Causes of gynecologic emergencies are varied, range from sexually transmitted diseases to trauma. Pelvic inflammatory disease, PID. It's an infection of the upper organs of the reproduction. It occurs almost exclusively in sexually active women. It can result in increased risk of ectopic pregnancy or sterility. And ectopic pregnancies where the fetus develops outside, anywhere outside the uterus. And sometimes it can be in the fallopian tubes and it can rupture. That's an ectopic pregnancy. Most common sign is generalized low abdominal pain. So PID is common in women who keep up their urine, women who are sexually active. If a woman has a sexually transmitted disease, it can put them at risk for pelvic inflammatory disease. Now, sexually transmitted diseases, STDs can lead to more serious conditions such as PIDs. Chlamydia. This is an infection that can permanently damage the reproductive system of a female. It is very common, a very common STD. It is caused by bacteria. It can be mild in symptoms, or the symptoms can be absent. It can spread to the rectum, can progress to PID. Bacterial vaginosis. Now, bacterial vaginosis is a condition where the normal bacteria is in the vagina is replaced by abnormal bacteria. So usually there is bacteria, normal bacteria in the vagina, right? But it can be replaced by other bacteria and cause an imbalance. This is what bacterial vaginosis is. Most common vaginal infection affects women ages 15 to 44. Normal bacteria in the vagina are replaced by an overgrowth of other bacteria. Untreated, it can progress to premature birth or low birth weight in pregnancy and PID. Gonorrhea. Now, gonorrhea is another bacteria. This bacteria now affects the mucous membrane of the reproductive tract. So that's what it affects. It grows and multiplies rapidly in warm, moist areas of the reproductive tract, which include the cervix, uterus, fallopian tubes in women, urethra in men and women. If untreated, can enter the bloodstream and spread to other parts of the body. Vaginal bleeding. Now, vaginal bleeding can have numerous causes. It can be abnormal menstruation, it can be vaginal trauma, it can be ectopic pregnancy, it can be spontaneous abortion, it can be from cervical polyps or cancer. Patient assessment. Obtaining an accurate and detailed assessment is critical. You will be able to gain only a primary impression of the problem in the field. Thorough patient assessment will help determine how sick the patient is and whether life-saving measures are needed. So your assessment will determine the most appropriate approach and interventions for the patient. Scene size, scene safety. Gynecologic emergencies can involve a large amounts of blood and body fluid. Involve police if assault is suspected. In sexual assault, it is important to have a female EMT provide care once that is possible. Sometimes the MOI may be easily understood from the dispatch information, such as sexual assault in other patients. Patient history may reveal the nature of the condition. After your scene size up, next phase of the assessment, primary assessment. Form a general impression. Is the patient stable or unstable? Use your AVPU scale. Assess airway and breathings. Always evaluate first to ensure adequacy. We know these things at this stage. Circulation, pulse and skin color, temperature and moisture can help identify blood loss. Most gynecologic emergencies are not life-threatening. If the patient has signs of shock, rapid transport is required. After the primary assessment phase, what is the patient's GCS? Should have an answer. Does the patient require a rapid scan or focus? Is it a load and go patient or a stay and play? These questions should be answered. After you package the patient for transport, once the patient is talking to you, talk to the patient. So the next phase would be the history taking phase. If the patient is not talking to you, focus on your vital signs, think about the physical findings for the patient, and then think about who can give you information about this patient. So history taking. Investigate the chief complaint. Some questions are extremely personal. Ensure the patient's privacy and dignity are protected. For abdominal pain, ask about onset, duration, quality, and radiation. Provoking or relieving factors. Associated symptoms such as syncope, lightheadedness, nausea, vomiting, and fever. And for a female, always consider the possibility that they might be pregnant. So when was the last menstrual cycle? For vaginal bleeding, ask about onset, duration, quantity, number of sanitary pads, soak, associated symptoms such as syncope and lightheadedness. Sample history, ask about birth control pills or devices, ask about medical conditions, and last, menstrual cycle. After the history taking phase, it's a secondary assessment. Pertinent secondary assessment findings should include vital signs, blood pressure, pulse, skin color, orthostatic vital signs, which are positional vital signs, abdomen, distension and tenderness, genitourinary, visible bleeding, neurologic, mental status. Physical examinations should be limited and professional. Only examine the genitalia if necessary to treat the patient. Patients age 65 and over may have concerns related to hormone replacement therapy, cancer, pelvic floor collapse, or urinary incontinence. Vaginal bleeding. Visualize the bleeding and ask about quality and quantity. Use external pads to control the bleeding. Observe for vaginal discharge, syncope, fever, nausea, and vomiting are significant in gynecologic emergencies. Vital signs. Assess the patient's heart rate, rhythm, and quality, respiratory rate, rhythm, and quality, skin color, temperature, and condition, capillary refill time, blood pressure, consider orthostatic vital signs, consider non-invasive blood pressure monitoring to continuously track patient's blood pressure. After your secondary assessment, reassessment. Repeat the primary assessment. There are very few interventions with gynecologic emergencies, so we have limited interventions as EMTs. Communication and documentation. communicate all relevant information to staff at the receiving hospital, include possibility of pregnancy, carefully document everything, especially in cases of sexual assault. Now, the emergency medical care. Maintain the patient's privacy as much as possible. If in a public place, move to the ambulance. Have a female EMT participate in the patient's care if possible. Use sanitary pads on the external genitalia to absorb blood. Document the number of pads saturated in the blood. External genitals have a rich nerve supply, makes injuries very painful. Treat external lacerations with moist, sterile compresses. Do not pack or place dressings in the vagina. Assessment and management of specific conditions. Pelvic inflammatory disease. A patient with PID will complain of abdominal pain, usually starts during or after menstruation, may be made worse by walking. Pre-hospital treatment is limited. Non-emergency transport is usually recommended. For sexual assault and rape are common. 1 of 5 women has reported being raped. 1 of 3 women will be sexually molested. Men can also be molested. Men can also be raped. EMTs treating victims of sexual assault face many complex issues. You may be the first person victims have contact with after the encounter. You need to be very professional. You need to be tactful. You need to be kind and sensitive. These are important things to consider in how you interact with these patients. Be aware of drugs used to facilitate sexual assault or rape. If possible, give the patient the option of being treated by a female EMT. Your focus should be to provide medical treatment for the patient, offer psychological care for the patient, preserve evidence, take history, produce a patient care report. And this particular table, very important, treatment principles for sexual assault. Make sure you go through the table, make sure you understand the principles in terms of your approach for these patients. And that would bring us to the end of this chapter.